Copy.
Yeah, thank you. We are here in the boardroom. We have Shekhar, who will lead the discussions today, and we also have Professor Adam, who is our expert on this matter. John, Sean is also joined us. I thank you, Sean, for making time. As usual, is having the controls there. So, colleagues, welcome. Without further ado, because I know Sean is a very busy man, allow me, sir, to give you the first opportunity to say a word to our colleagues on this very important matter.
Okay, thank you. Good afternoon. Before we start, I want to thank you again for all your hard work and contribution to the institution and the community. One of the observations that I have had, and then I'm sure Professor Adams and Shekhar can add to it, I'm seeing a gradual increase in the number of the COVID cases in the hospital. At the beginning of this month, in the area that we designated for a COVID, understand, this is really important. I don't want anybody to get to a Twitter or basically SMS, Aga Khan is full of the COVID patient, okay? Don't do that. In the area that we have designated for COVID, such as field hospital, one wing in Princess Zara and the third floor, you know what? We are now, at the beginning of the month, we were around 40% occupancy. Now we are seeing from the total number of the beds that we have available is around 70 to 72, which shows me that there is a lot of community spread. Professor Adams can basically add more regarding the positivity rate that we are seeing when people, they come for the PCR test. And also the number of the patients that they come here for elective surgery. And since we offer the COVID test for free, we have seen also the number of cancellation has gone up, not to basically perform the surgery because these patients are COVID positive, okay? Therefore, it is important again that we stay vigilant, we put our mask on, we wash our hands, maintain social distancing. When we get to a break room, there are not 20 in one small room, okay? There is sufficient ventilation. These are all important things. But the good news is we are going to get our vaccine next week from the government. And Shekhar and Rashid and Professor Adams and everybody and the rest of the team has been working on it. We have had a meeting with the Ministry of Health. And next week, hopefully, we will start basically rolling up the vaccine. The vaccine is for everybody that works in the hospital. Physicians, housekeeper, waiter, waitresses, engineering staff, private physician. But one of the challenges that we have, we do not know how many doses we're going to get. If they give us around 3,500 to 4,000, everybody is going to get vaccinated. If they decide to give us 1,500, then we do have a policy that we have developed for AKU-wide, and that policy is very specific regarding who are the priorities and how we're going to roll out this vaccination. The rest of it, I mean, that's all I want to share with you. I want to thank you. Now, I don't know, Sami, if Professor Adams and Shekhar, they want to add anything more on this?
Sure.
Shekhar?
Yeah. So as per the plan, Monday we will get the vaccine, and that's what the latest news is. And we should start vaccinating on the Tuesday. But like Sean said, we don't know what numbers we are going to get. So we have a policy for who should get first, who should get second. We have a priority. So please do not rush to the vaccine area thinking that you're going to get. You will be intimated when you're going to get it. So we are making a plan. If it is, like Sean said, if we're going to get 2,000 also, not even 3,000, all staff will get. So please have patience. You had patience for so many days. I'm sure that you'll have a patience for another big, and we have planned that within a week, we are going to vaccinate all our employees if we get the vaccine. So that is the program. We are going to have 4 registration counters, 8 triages, and 5 vaccine center of nurses vaccinating. So we'll have a lot of people working on it. So at an average, we'll hit about 300 per day easily, and we're expecting even more.
Yeah, the other thing is, Shekhar, if I may add, the way that is working right now, this is going to be for frontline workers or frontline people, which includes healthcare, police, military, was it also teachers part of it? And if we have become Aga Khan University as one of the vaccination center, it's not exclusive to our employees. Other people that they fall under this category, which has to be physicians, let's say if the physicians from Mediheal across the street wants to come to Aga Khan for vaccination, when we prove that they are physicians, they can get it here, okay? If a teacher that lives in close proximity of the hospital wants to come here, they can get their vaccine here. Therefore, this is what I was telling you. I don't know how many doses we're going to get and who are the people that they're going to come here. We are trying to see if we can basically prioritize our own employees first. And once we are done with our own employee, then start basically vaccinating the other people that they are eligible. This is something that Shekhar and Dr. Mativa and Rashid, they need to talk to the Ministry of Health and see if we can basically, even within this phase, we're going to have 2 phases. The first one is let us vaccinate all our own employees. When we are done with that, if then you give us additional vaccine, we will go ahead and do other frontline workers. That I don't know. Just be aware of it, okay? Anything else, Shekhar?
So just if we have enough vaccine doses, great, everybody gets them. If we don't, that's what a lot of the discussions are about. And those who have already had COVID could wait until the others have had their vaccines. That's been done a lot of places. And we know that after COVID, you have a substantial level of protection as well. We're not going to be looking for whether you've had it or not. So this would be a self-decision on letting the others go first, essentially. And that applies only if we just don't have enough doses for everybody. So I guess while we're continuing on the vaccination, there's been a lot of publicity about Denmark stopping the AstraZeneca rollout because of, as far as I can tell, a couple cases of pulmonary embolus or leg clots after having had the vaccine. What is much, much more likely, though, is that's just the normal expected amount in the population. That has not emerged as a problem in the vaccine studies or in the rollout in the UK, for example. So I think it's actually unfortunate that those countries have done that, because now we will have more lives lost because of delayed immunization. So I would not let that scare me away at all. The vaccine is about saving lives. And I know there's a lot of vaccine hesitancy in certain groups within the country and in many other countries as well, saying don't get the vaccine. But the reality is that, if the US had had the vaccination a year ago, they would have already saved 500,000 lives with the vaccine. There's never been a vaccine in history with that much potential for saving lives. So think of it, when you think about any risks, known or unknown, weigh them against the known risk of COVID if you get that. And I was just referring to deaths there, because remember, and those of you who have seen patients in the hospital, some of them are in for weeks. And when they go back, their respiratory function is not normal. And we hope it will return to normal. But that kind of severe illness can be prevented with the vaccine. So we want to strongly encourage everybody to go for it.
Okay. Is Prof. Lukoya online? Okay, colleagues, you've had the most exciting news that the vaccine is here with us next week. Thank you, Sean, and the leadership team for making this happen. Now, colleagues, this is your time to make comments, ask questions, and make any contributions that you can. And the leadership team here, Professor Adam, will be able to respond to your comments, your questions as much as possible. You have any?
We have the questions coming in.
Yeah.
There are 132 people online right now. Okay, so first question, like every time it comes, is the vaccine voluntary?
The answer is that at this time, the vaccination is voluntary. And again, for your own protection, we would like as many people as possible to have the vaccination.
There are two issues here, and I want people to be very clear about it. The university is developing a policy and procedures for vaccination, not just for COVID, for the entire institution, which Professor Adams kindly, has helped us. When you say voluntary, the question here is, if you are in the food services, I might not mind. But if you are a frontline nurse and you are working in ICU, should it be voluntary or not? If you get COVID and you transmit it to a patient, what is my liability or the institution liability? Therefore, it is not a black and white answer. It depends on the circumstances. Do you find what I mean? You cannot say, I'm in ICU, I'm in contact either with the COVID patient, or you get it outside, you come here and you give it to the patient in ICU and the outcome is not good. Who is going to be responsible for it? We are in uncharted territory. There are laws in Kenya, which is a public safety law. How do you interpret it? That's not my responsibility or Professor Adams. It becomes a matter of interpretation by the legal scholar and attorneys. If an attorney says under the public safety law, the safety of the patients supersede basically the will of the employees, then the issue becomes no, it becomes mandatory. I don't have an answer for it. I don't want people right now, it says Sean or Professor Adams says it's voluntary, okay? We don't know. When we get to that point, we will cross the bridge.
Is Sonam faculty and staff going to be considered now that we deal with the students?
I'm sorry?
Is the Sonam faculty and staff, means the nursing side, the AKU, university side, going to be considered now for vaccination that they deal with the students?
You know what? It's an interesting question. Maybe Sammy write this one out, because one of the group that is included in these vaccinations are teachers. Do we consider, for example, the professors at the Sonam as a teacher? Yes, they are. Okay. Can we include them? I don't know, because when we had a conversation with the ministry, they didn't say that they're going to also vaccinating all the professors at the universities. Am I correct? They say teachers. Are they talking about elementary teachers and high school? I think this is a follow-up questions that we should ask from our colleague Shekhar in the Ministry of Health. If they say yes, then of course they are going to be included. If they say no, sorry, I'm not the one that makes that decision. There is a shortage of vaccine even for the first phase, as they were saying.
So will the dependence of the
for
staff?
Sean, if I may add, this is Dr.
Yes.
Mativa. If I may add, I know I talked to the Deputy Director at the NMS Health Department, and they are clear that they have different people dealing with different categories of first line or the group targeted for phase 1. For example, the public health departments up to the sub-county level are the ones doing the tallying and the organizing for healthcare workers. The education institutions have a different line of identification and support, the police and others. So for us, we are only channeled through the health support system or supply system for the vaccines. So those other groups are supposed to have been contacted already by the departments from the county that deal with those particular services. So they are not counted in the vaccine we are about to receive. This is just for healthcare workers.
But can I ask you, Dr. Mativo, may I please request that you get a clarification from the Ministry of Health and see, for example, if our colleague from Sonam can be counted as basically part of the AKU. And that would be helpful. I don't want to do anything that is going to basically create a tension between us and the government. But can you please find out, and if they say yes, I want it in writing, that when we start basically administering the vaccine to them, nobody is going to come and say we did not follow the guideline that was established by Ministry of Health. I appreciate if you can follow up on that.
Sure.
And another question related to that, many of the faculty there are registered as nurses already, and they've been fairly liberal in including healthcare workers in the vaccination. So we can also explore if they're eligible just by virtue of being healthcare professionals.
Yeah, that's a good point, Professor Adams. Thank you.
So we have a comment on this discussion here. Sonam nursing faculty are also healthcare workers. Are they nurses?
Listen, I'm not in the business of interpreting the guidelines. Therefore, I'm not going to make comment, yeah, I agree with you, I disagree with you. That's the reason I specifically asked Dr. Mativo to find out. But Professor Adam had a very good point. When we had a conversation with the Ministry of Health, the issue was for healthcare professionals that they have a registration number, they can come, show their ID, show their registration number, verify it, and then give them the vaccine. They didn't say if they work at Sonam or they work at basically Timbuktu, don't give it to them. I don't know. Okay, I can read it both ways. The best thing here is let Dr. Mativo talk, find out. Either the answer is yes or no. If the answer is no, then we have another way that Professor Adams interpreted, and we will make a decision. Our intent is not to deny them.
Sean, with regard to those who are healthcare workers, the process is already clear and we know it. One is the information they asked of us, and Sami is there to clarify. First, they wanted to know the healthcare workers within the university hospital, and that is the data Sami sent. Now, for healthcare workers outside the hospital or not on the hospital payroll as such, they are eligible for the first phase, but they would have to register through the online system. Now, we know the first 2 weeks, the online system is not up and running. So when they go to a vaccination center, including our center, if we get sufficient vaccines, they will just need to identify themselves, they register on site, and they can receive their vaccines. As long as they can be verified to be healthcare workers, they're indeed eligible.
Thank you, Dr. Mativo. And the other thing that we need to know, if you are a healthcare worker, you are not obligated to come to AKU. Even if some of the colleagues, they want to go to Kenyatta National Hospital or they want to go to other hospital that they have been designated for this phase, you can do that. Okay?
That is true. That is true.
Will the dependents of the staff will be eligible for vaccine? The consecutive question to this question is if in case there are enough vaccines.
No, there isn't.
And this phase, they have clearly limited only to healthcare workers. So unless your family member is a healthcare worker, we will not be allowed to do it. under the Aga Khan plan, yes, they will be included. We just can't get the vaccine yet.
We are planning to see if we can get a vaccine ourselves. Either buy it. There is a lot of discussion going on at the university level to see how we can bring vaccine to the country. If we are basically able to do that, then definitely all the dependent are eligible. We have even submitted that number to the Ministry of Health because there was a rumor, if you guys remember, that the Kenya is going to get 24 million basically doses of vaccine, but nobody says it's going to come in installment. Okay. The other issue that we had a conversation and we found out from our colleague from the Ministry of Health, actually the true vaccination for the different phases and the population is going to drag on until 2023. Okay. Now they are trying to also allow private entities or pharmaceutical to import vaccine. But the problem is the indemnification. This vaccine that is coming through the COVAX, it has been already indemnified. It indemnified the government and indemnify basically the, how should I say, administrator. But whatever comes through the private pharmaceuticals, there is no indemnification, which has created some difficulties. You know what, at the end of the day, who is responsible if something goes wrong? It's not as easy, it's complex, but once we have access to vaccine, definitely our intent is to offer it to all the dependent of our employees.
See, the allocation for the complete Nairobi County is only 54,000 vaccines.
And the population of Nairobi is 4 million.
So the 54,000 will surely go to the health workers only.
Some doctors have gone to Kenyatta for first vaccine. How are we going to ensure they do not get their second dose before the staff getting the first dose?
You see, there is a time frame, and Professor Adams can tell me better. I think the time frame between the first dose and the second dose is 8 weeks. Am I correct? That's what we heard.
Minimum 4 weeks and probably more benefit by waiting a bit. So if they come too early, they're doing themselves a disservice by getting it too soon and not getting the best immunity.
And now on the registration, there is a registration portal that you can cross-reference, okay? This is nothing candy that the more you get, the better it's going to be. You can also have some serious consequences.
So in Kenya, the
Yes.
guideline is that the second dose will come 8 weeks after the first dose. And once you receive your first dose, it goes on to the portal. So once the portal is up and running, one will not be able to register for another dose until 8 weeks after the first one. So that would be one way. But as Rod said, with appropriate education, there is no benefit of coming for a second dose the week following the first one. So we are hopeful that they will apply rationale and not show up.
Is the vaccine safe for expecting women? What of those breastfeeding? And are there any guidelines on vaccination in pregnancy?
So during pregnancy, there has been certainly been some discussion. None of these are live virus vaccines, nothing that's on the market right now. So there are no theoretical problems with pregnancy. The only limitation is that the studies were not done with pregnant women. That said, there is likely to be benefit to the pregnant woman and to her newborn by having the vaccine. So personally, if I was recommending to someone who is pregnant, I would say my recommendation is to go for it. What this approach of the CDC in the US is that it will come down to an individual decision between the doctor and patient on whether the woman goes ahead with vaccination during pregnancy. Breastfeeding is no problem, and it's recommended for anyone who is breastfeeding.
What about the side effect of clotting with AstraZeneca vaccine? how do we address this?
First of all, it's not a side effect, and it is highly unlikely to be related directly to the vaccine. That's a relatively common thing in the general population. And when you're vaccinating thousands and millions of people, you're going to see those kinds of things. So anyway, it's probably not directly the result of the vaccine. And also remember that one of the big problems of COVID has been clotting. And so if you get COVID, your risk of clotting is there. Whether the vaccine increases the risk at all is not clear, but not a lot. But COVID definitely does.
Looks like that we have a new variant of COVID-19. Is the vaccine targeting this variant or the previous one? Are the 2 doses going to be lifetime?
So that's several questions together. There's a lot of interest in all of the new variants now, and the likelihood is that the vaccines will have some efficacy, but not be as good for those variants. Based on the experience from South Africa, it probably will still protect against severe disease. And so that's the expectation right now. In terms of if and when a booster is going to be required, we don't know yet. The evidence is accumulating that after natural COVID infection, there will be a long duration of protection. But for the vaccine, we don't have enough information yet. My personal prediction is that the main role for the boosters will be to keep up with the variants as we go forward. Right now, the manufacturers are working on new combinations that will hit the current variants, and that could be a game of catch up with this virus. So most likely, at least for the near future, we will have boosters, but more about the variants than about loss of immunity.
What are the chances that government will provide vaccines for the second shot?
We're expecting them to.
You know what? Your guess is as good as mine.
But what is worth noting is that in some of the post-vaccination studies, there is substantial protection even after the first dose. So I'm not saying that to suggest that you should not get the second dose, but within about 10 days after the first dose, there is actually a measurable level of protection. And that will increase over time, and it will probably increase with your second dose. So we do expect that second dose to come, but even with the first dose, there will be some protection.
You know, as the developed world, or you know, in Europe and US, they get basically the people vaccinated. There is a time that is going to come. I don't know exactly when, end of this year or 3-4 months from now, that the supply of vaccine is going to change.
Mm-hmm.
Okay. If US has basically vaccinated everybody, then you know what? There are 350 million that they have done it. There are 350 million in Europe. That's 700 million. Am I right? Therefore, whatever is available in the market most probably becomes available in this part of the world. Johnson & Johnson is another vaccine that is only one shot, okay, which it has rolled out in the US. They supplied the government with 80 million doses, and there is another 100 million that has been ordered. Therefore, as long as there is a market for it in the US, don't expect that you see it in this part of the world. But once the market in the US has been saturated and over, then where do you think they're going to go? They're going to come in this part of the world, Europe, and you know what, China and India.
Will vaccinated people get some sort of a certification?
Yes, it comes from the government. Once you get your second dose, you will receive basically an SMS from the government. Then you can go to the portal and then you can print your basically vaccination certificate.
One of the panel members is using N95 mask, please advise.
Which is Shekhar.
With?
One of the panel members is using N95 masks, please advise if this is okay.
I'll make a
No,
quick comment there. The N95 is intended predominantly for clinical care of COVID positive patients. Other people choose to wear them. However, an N95 that fits well is very difficult to wear for a prolonged period of time. I find myself unable to do that because I have a good fit when I have an N95, so I'm happy to remove it when I exit from the room. But you see, you never get a good fit with the beard.
No, you don't.
So,
That's
Sorry.
number one. Even if you have an
Sorry.
N95, put glasses on. If it fogs, then it not fitted.
I have
Yeah.
another part of
Sorry,
that question.
sorry, everyone. There is a previous question from the same person.
Yes, yes.
So if you read the last one, you won't get what she meant. She was actually asking that N95 has been discouraged in Aga Khan because it can protect the user, but the user can infect others if COVID-19 infected. So she followed that one with a second question that one of the panelists is wearing, but I think she has missed which N95 was banned from Aga Khan Hospital.
yes, so if you look at Shekhar's N95, there is no ventilation port on it. The problem with some of the N95s, the one where you see this little circle sticking out, that's an exhalation valve so that your air, when you breathe out, goes unfiltered. Those masks do not protect anybody around you. They only protect yourself. This kind of mask without the exhalation valve will protect both directions. So this kind is okay in that way. The one with the valve is not okay.
Do we need to do COVID test for travel after getting the jab?
Yes.
I think that's going to change over time, and it's even changed in different countries over time. So what's true now may be different in a month or in 3 months or in 6 months.
At this time it is, Prof, because
Yeah.
I'm leaving tonight, okay?
Yeah.
I have my vaccination. I have a card from CDC, but the airline still is asking for PCR. If I don't have it, they will not let me on the plane. That's it. At this time, until everybody is vaccinated, it depends on airline to airline. Like for example, KLM is different. KLM, they want the PCR and also antigen, both of them. And antigen has to be done 4 hours before you get on a plane. And the PCR should be 72 hours, okay? Professor Adams can basically explain why they want both of them, because it's much safer, okay? But each airline has its own regulation.
But my guess is that over time, we will see that change and that somebody with proof of immunization will be allowed on without the testing. But that's not the case yet. And in fact, whoever is traveling, what's true this week may be different next week. We've seen rapid changes from airline to airline, from country to country, and you just have to check within the days before you depart.
The government also have ordered Russian vaccine. Will this be safer than the AstraZeneca vaccine? Any safety issues with it?
When you look at the side effect profile, the side effects for all of the vaccines that are out there are nearly identical. They're probably related to our immune response to the spike protein that forms that immunization antigen. So there's no real reason to believe it will be any better or any worse in terms of side effects. The efficacy has looked reasonably good for that vaccine. So it's likely that it will be an acceptable one to go with. We have less information about it because it hasn't gone through the regulatory requirements of some of the other vaccines.
India has refused emergency use authorization of Pfizer vaccine because of lack of safety data, after which Pfizer subsequently withdrew their application. How robust and safety data of these vaccinations given by the suspicions in Denmark, Norway, and Iceland as well?
Well, first of all, the Pfizer vaccine is probably not coming here anytime in the future. The ones that have gone through the FDA have presented substantial data. It's likely that Pfizer decided that since they don't have enough production for their existing markets, they weren't willing to go through extra regulatory requirements to go where they don't have extra doses. But if you look across the world, the biggest issue with Pfizer is the requirement for -80 or -20 freezer storage. But in the US, you see a wide, millions of doses of Pfizer given now. In the UK, they have given millions of doses of Pfizer. And I think that alone is adequate for safety data.
There's one suggestion. Hopefully, our senior leadership should take except for Sean, which is already done, the vaccine so that others get encouraged.
Sure, we'll do that, yeah.
Can I chip in?
Yes.
Yes.
Well, this is Professor Masharia here. I just had my vaccine this afternoon. So for those who are wondering, medical people are taking or not taken, because I was told by another doctor that it's very easy for medical people to actually get the vaccine. So you can watch me and then maybe save yourself. If I'm not safe enough. That's not the point I wanted to make. The point which I wanted to make is that there's a very big deal being made about this vaccine issue. We are pediatricians and we've lived with vaccines in children for many years. And there's a lobby group which is very, very vocal. And is always opposing administration of vaccines, even for children, like measles vaccine, which is a major killer, and another one called MMR. We really had a lot of fighting within the pediatrics to actually counter that group, because they hear of one side effect like autism, which is one which was cited for the MMR vaccine, and they forget all the benefits that accrue out of that vaccine and just hammer in that one. There's not a single vaccine, even those ones of early childhood, without side effects. As a matter of fact, some of these commonly feared side effects, like you get fevers, you get headache, you get this and that. Those level of side effects are actually good, because it's indirectly telling you that the vaccine has actually had a take within you. If you take a vaccine and you feel like nothing ever happened, you are probably the kind of person where one has actually not successfully seroconverted. That's where the second dose, of course, becomes vital. So let nobody tell you that in a vaccine, you'll be given, you will not have side effects. It's a drug like any other drug. Paracetamol, which you use on a daily basis, you read the leaflet on paracetamol, and you hear it can give you liver failure and all those things. One may be in for 300,000 cases. Do we stop using paracetamol? It's all medicine, practice of medicine is always an issue of balancing benefit and risk. That's what we as doctors do all the time. Balance risk and side effects, because there are no medicines without the side effects. I'll stop there, thanks.
Thank you, Prof.
Well stated.
Yep.
We may want to have a mechanism of our staff of reporting and any experienced side effects and derive publications from there.
That is built into the system. Any reporting of severe, people won't be reporting their sore arms because that's going to be common. But anything severe that occurs after the immunization, whether or not related to the vaccine, will be reported.
So that's it for now.
That's it?
Then let me make another comment. And this is particularly to those providing active COVID care now in the hospital. One of the challenges in admitting patients is that for the first day, you suspect that they have COVID, but you don't have proof because they don't have a PCR yet. So do you put them in the COVID ward? No, you can't. You have to put them in a separate room until you know for sure if they're positive or negative. But as of today, at least I hope it's in the system and all set up, we can also do the COVID antigen test. And that antigen test is less sensitive than PCR, so it's not going to replace PCR. But for somebody where you suspect COVID and you need an immediate result for making those decisions on what their treatment is or whether they can go into a COVID ward, if the antigen test is positive, and you get that within 15 minutes, then you can proceed with that result. If it's negative, it does not rule it out. It means you have to wait for the PCR. So we can have further discussion, but again, the antigen test will be helpful in some of those patients where you need an immediate result.
I think this information needs to go to all doctors.
Yes.
So have you started doing the antigen?
I think it's in the system and working today. I haven't tried to actually go into care and try to order it yet, but it should be set up by now.
Okay.
That's it? Okay, colleagues, we seem to have come to an end of the questions. And so allow me to thank you profusely for joining and to encourage you to shoot any questions on email. And we'll always be able to respond either during the week or in the next forum. Allow me also to thank the panelists who have joined us here in the boardroom and online. Jem, Dr. Kiva, thank you so much. Before Sean makes the final comments, I think there's one more question from...
Yeah. The person is asking for the consent and documentation, we will only rely on government portal?
Or?
For
Yes.
consent and documentation.
Documentation, everything is government portal, but I talked to Rashid to also develop another consent, okay? That we will take that one also into consideration. And we will still, it's advisable for us to have also our own consent form, okay? That's what I want.
That is it?
Consent form.
Yes, you get the consent that people, they know risk benefit, and on the top of it, please work with Rashid. I brought it from US when I was there, when I went to get my own vaccine, and it has CDC and everything. It tells you there is a checklist. And one of the things that they ask you, if in the past 60 days, for example, you have had COVID, there is a questionnaire and then tells you benefit and this and that, and then you sign it, then they will give you your vaccine. I think it is prudent for us to still do that, okay?
One more, Sean, for you. Any comments on the recent promotions and the announcements for the staff received?
Yes, the recent promotion. I got demoted. I'm not the CEO anymore. Listen, these are basically, as you know, Rashid is an interim CEO, and there will be an international search. His position as a CFO is not going to be filled. I put everything basically in a memo. and Rahim Khaja from university will assume basically responsibility for finances of the institution. Khurram has been promoted to the COO of outreach clinics. Clinics on campus, they are under the leadership of Shekhar. Jemima is basically in the same position that she was. And the program administrators have been basically, the title has been changed to the director of nursing for the respective areas. Valentine basically has been with the university now for 4 years. He was a legal officer who was promoted to a legal counsel and the manager of legal department. Pauline, that used to be acting basically director of marketing and communication, has been confirmed in her position. And Mildred, that used to work with me, now is the director of vice president health services office, because she will be working with the colleagues in Afghanistan, in Pakistan, here, and the future, when we have a hospital, for example, in Kampala, and also all the clinics in East Africa. And Winnie is going to be working with Mildred. Janet is going to stay in the office of the CEO. And I guess that's it. I said everything. Now you know all my secrets. I send it to you, but if there are any questions, I will be more than happy to answer them. We are in a process of recruiting 6 chairs at the university.
Yeah.
These 6 chairs, basically, it's an international search. We do have basically a, how should I say, headhunter. And the search committee is going to be very diverse. It's going to be faculty and also colleagues from Pakistan. Let's say if you are doing a search for the Department of Pathology, the chair or the service line chair of Department of Pathology in Pakistan is going to be a part of the search. We will have also colleagues from the private physicians to be part of the search, and for each department. The other one that I forgot to say, I apologize. As you know, Dr. Tawahir left, and Dr. Mativa now is interim chief medical officer and associate dean of clinical affairs. That position has been also posted, and we will do a recruitment. That's it. Anything that I missed, Sami?
That's actually, you've covered. Okay,
That's it.
so Sean,
Yes.
final comments?
Guys, I want to thank you again, as I said, for all your contribution. I think one of the trend that I have seen, and Shekhar can correct me and the rest of the colleague, the hospital is busy. And I think the reason we are busy is that to some degree, people, they have learned to work with basically COVID. People, they realize if they don't care during the COVID, it might be more dangerous than COVID. And also, I believe the other reason is, which I'm extremely thankful, is really the dedication of all the colleagues and the staff. When people, they walk in and do not see anybody without mask, they see we are enforcing the safety measures. I think that gives a confidence to the consumer that if there are places that I have a choice to go, Aga Khan is the first one. And the evidence of that is we have now patients that they have come here for a COVID care, and there are 7 different nationalities. I cannot tell you, but they are from 7 different countries, European countries, different countries. And I had some colleagues that they came from Democratic Republic Congo. They were extremely pleased with what we are doing, and they are asking us if we would consider to open a hospital there or clinics. We had a visit by the UN High Delegation. They were extremely basically pleased with the quality of services that we are providing. However, the reason I'm sharing this one with you is I cannot take credit for what you are doing. And I'm extremely proud to be associated with you. And I want to thank you for what you are doing and the differences that we are making. There is another exciting thing that is coming, hopefully by May. We are we applied for our accreditation to Joint Commission to become a stroke center. Now listen what I'm telling you. I want you to listen very well. I know we're going to get it in May, the way that we got basically our accreditation for being a chest pain center. When we get this one, we are the first hospital in the continent of Africa with this accreditation. For chest pain center, we are the second hospital in the continent of Africa with this accreditation. The only other hospital that has this accreditation is the hospital in Egypt. That is a quite accomplishment, and I'm very thankful for that, okay? Work with our colleagues, with Dr. Mativa and also the rest of the colleagues in the quality department that in May, you guys are going basically get this. An interesting comment that was made by His Highness and the board, why Karachi is not doing the same thing that basically Nairobi is doing. Now they are thinking about it when they're going to go for these two accreditations. This time, I don't want anybody to misunderstand me. This institution has been the trendsetter. We have a lot of basically talent here. We have a lot of talent in Karachi. We have a lot of talent in Afghanistan. And I have been working with all the colleagues to bring the institution together. As a result, we developed basically one policy for the entire AKU health system for immunization. We have sent our first colleague from here for a GI fellowship to Afghanistan. To Pakistan. We are anticipating two graduates of our PGME from Afghanistan to come to Nairobi, one for fellowship in infectious disease, and when we have also approval for the oncology, another one for fellowship in oncology. That's what we are trying to do, okay? And as I said, I'm very thankful for everything that you have done. And I know this is the beginning of seeing changes. The vaccine is coming, and there will be the light at the end of the tunnel. And I'm sure when we are done with it, the slogan that we have, basically becoming stronger, we will be a much more stronger and agile and flexible institution. Thank you again.
And may I make another quick set of comments, just asking everybody to be especially safe during this time of surge. And we're finally seeing it in the national numbers, where the numbers have gone up. But more than a week ago, we started seeing it in a major increase in our positivity rate in the lab. The surge is here. We're seeing it in many ways. And we're also seeing it in our own staff. We've had a number of infected staff. They are not being infected from their patient care. They are being infected from the community, from going to funerals, from spending time in close quarters within the hospital. And just keep that in mind. The higher our rate is in the community, the higher our risk of exposure is. Now is the time to be especially careful. Avoid going in crowded vehicles, avoid the crowded rooms. That's where you're really raising your risk.
Thank you.
So let's be safe.
Thank you, Prof. Guys, as Prof was saying, we know that the British variant is in Kenya. Am I correct, Professor Adams? The reason I know the British variant is here because I know how it got here, okay? Therefore, the South African, we don't. And the British variant, you can correct me, Professor Adams, based on the article that I read, is 20 times more infectious.
Not that much more, but it is more infectious.
Okay.
And yeah.
I read somebody told me 20. It's your area. If that's the case, and this variant is in Kenya, the probability of basically you to be getting COVID, if you are not cautious and you put your guards down, is much higher. I mean, before even I got vaccinated, from the beginning of this, pandemic, I'm not going to tell you what to do. I was very cautious to make sure I have a proper mask, wash my hands, maintain social distancing. Even when we have the meetings here in this room, I make sure that the windows are open to get basically ventilation. Please be careful, okay? And because you want to protect yourself, you want to protect your loved one, you don't want to be the one that takes this one to your home, to your parents, to your kids. And God forbid, if there is a bad outcome, you're going to have a hell of a time to live with your own conscience, okay? Thank you.
Thank you, Sean. Thank you.
Checker, anything?
No, like even after the vaccination, we can't stop these precautions. That's what both of them
Yes.
are telling. That's what.
No, I got my vaccine a month ago. I never go anywhere without my masks.
Yeah.
Okay? Because you can fool yourself.
Yeah. Thank you.
Thank
Thanks.
you. Thank you.